Four-year-old Elizabeth Johnston is almost back to her usual lively self, but she's still using a ventilator after a respiratory virus put her in the Children's Hospital in Calgary for several days last week.
We were worried, very much so. You know, just to see how quickly it progressed. I mean, Tuesday morning she was fine, and by Wednesday morning, I mean, she's in a bed, hooked up to oxygen.
Johnston, who is married to a CBC employee, says Elizabeth had enterovirus. Symptoms include diarrhea, vomiting, shortness of breath, and high fever. There's no vaccine or antiviral therapy available.
The doctors said that they had seen some of these cases recently, and they knew that they had to get her on oxygen right away and start treating her symptoms.
Alberta Health Services says over the last several weeks, the Children's Hospital has seen an unusually high number of respiratory cases. It's added 5 extra treatment spaces to the pediatric intensive care unit. It's also running lab tests to find out whether an outbreak in the United States has made its way here. The strain is called Enterovirus D-68. Doctors say it seems to be sending more children to intensive care than a typical virus.
We're very alert. I think my colleagues at the hospital are very much on their toes about this, and they don't want to miss it. They want to be sure that their diagnosis is accurate.
The Johnstons are still waiting to find out what strain of virus Elizabeth had, but mostly they're just relieved to see her recovering. Alison Debster, CBC News, Calgary.